Okay, hello everyone. Welcome to our Facebook Live today with Laura Sonnefeld, Facility Dog Program Coordinator, and Valerie Lomar, Recreational Therapist at Cook Children's Hospital. We're so excited to have them here today. We also have Steve and Zuni, Facility Dogs, here for you to meet as well. So these two facility dogs work alongside their handlers in their role at the medical center and are incorporated into their interactions with patients. So thank you all for joining us today.
Thanks for having us.
Yeah, so excited to be here.
Lisa, thank you. Girl. She might try to crawl over
Yeah,
here.
we'll see how long these two last in chairs. So we want to make sure we got them on screen to start off with at least.
Yeah, we are excited to see them, but understand if they make on and off appearances. So we do have some questions prepared for you today. I just want to start off with, what is the program Sit, Stay, Play?
It's a great question. So Sit, Stay, Play began back in January 2014 when our hospital had gone to a conference and they had heard about a facility dog program at Children's Hospital of Atlanta. Our director came back and said, we need to figure out how to have this here. Facility dogs would be fantastic. And they were able to get I'm not sure what Steve's doing right now. They were able to get the clear ahead from all of the people that needed to say yes, and they brought back our first two dogs, Ralph and Chanel, starting in January 2014. They were a brother and sister, and they started our program and kicked it off. But our program is our facility dogs work full-time alongside healthcare workers. So none of our handlers or volunteers, we're all full-time employees of the hospital, and we are people who have expressed desire or have expressed ideas of how we would incorporate a dog into our role. And so our dogs are here full time with us 40 hours a week, and they work alongside us. They're able to go wherever we go in the hospital, including coming into the bathrooms with us and everything as well. Sometimes that has to happen. But yeah, so we now currently have 6 full-time dogs, and we have dogs from 2 different programs, which I think you may have a question coming up. We can talk a little bit more about the training program in a minute.
Yeah, that is wonderful. Thank you for explaining that program. Wow, they are full-time workers getting a lot done. That's awesome. So my next question then for you is, what is a day in the life like for a facility dog? So they work full-time. Just would love to have a little bit of insight of what they're doing during that time.
Absolutely. So that's kind of a tricky question because of the fact that our dogs work with different people across the hospital. So like my role is different than Valerie's role. So I'll let her speak to a little bit more too. For Steve and I'm a child life specialist here at the hospital. So I am seeing patients all across the medical center, both on our inpatient and outpatient sides. And Steve and I are visiting patients who have maybe specific goals where Steve can help us to achieve those goals, whether it's a kid that's homesick or a kid that needs to ambulate after surgery. I can utilize Steve in that role and encourage kids to do that. Valerie's role is a little bit different, so I'll let her speak to that a little bit more.
Yeah, I think Junie decided she's done with that chair. So, all right. So, I'm the recreation therapist here at Cook Children's. I work mainly in the psychiatric department, both for our partial hospitalization program and our inpatient psychiatry department. And I see both of those programs each day. So in the morning, we'll get to see the kids over in our partial hospitalization program. She will come in and do my recreation groups with me. So I let the kids like socialize with her. She knows a lot of commands. She knows about actually more than 40. So she's got 40 plus commands. And so some of those commands I let the kids do. And so they'll do shake, they'll do fist bump, they'll do speak. They love that one. Just all kinds of different things. They get to pet her and interact with her as she moves about the room in our classrooms. And and then in the afternoon, I get to do the same similar activities in our inpatient unit. So I'm kind of more in those areas than all over.
And to give a few more examples of what our other handlers do. So we have, I believe at this point, 6 child life specialists who are handlers. We have 1 physician. We have a social worker. We have a case manager. We have a clinical therapist. We have another program coordinator, rec therapist. And I think that captures everybody. Oh, and we have 1 person who is also, she is a child life specialist, but half of her role is to provide staff support as well. So we're not only seeing just our patients and families across the medical center, we're also providing support for all of our staff. As you can imagine, especially hospitals are stressful enough, and then this last year and a half during the pandemic has been even more stressful. So they need all the support that they can get.
Yeah, thank you so much for sharing. And oh my, I'm just stuck on the 40 commands. That is definitely the highest I've personally ever heard. So that is amazing. Wow, so a lot is being done. There's some hard workers. Hopefully they have some time to relax and replenish some of that energy afterwards before getting back into it. So I'd love to know a little bit with, those 40 commands. I'm curious, what does it take to train a facility dog? Like maybe share a little bit about how long the process is and just kind of what that looks like.
Yeah, so we actually have dogs from 2 different training groups. So Steve is from a group called Canine Assistance, and Zuni is from Canine Companions. So I can speak a little more to Canine Assistance program. Just overall, the training process, both of these programs breed and train both service and facility dogs. So they are, let Steve hop off for a second. Both programs are training dogs to either work with individuals, whether they need specific services, or they are identifying dogs to work alongside healthcare workers. So the training process takes anywhere from a year to potentially 3 years, depending on programs that they're going to be matched up with. Overall, they are very meticulous about how they match up the dogs with their humans, which is incredibly important because, as Valerie and I can both speak to, like, our Zuni and Steve have very different personalities, and our dogs work so well with us because they really make sure they do a whole interview process. They try to figure out, how we're going to utilize the dog, where we're going to be working, and they want to make sure that they're going to put in all this work training these dogs, that they're going to put them with the right person. And so Steve is definitely the goofball of the group, which I think I take as a compliment. I'm not totally sure sometimes, but he is a really good match for me. I can play off of his silliness. Like, I feel like humor is one of my skills in my role here at the hospital. And so having a dog that's kind of a goofball and does ridiculous things is like super helpful for me. Because I'm the one that wants to try and get a laugh out of the kid that hasn't, smiled in 4 days. That's one of my goals. So it's a very meticulous program as far as matching people up. Canine Assistance is dogs across the country as well as Canine Companions. And so the process looks a little bit different with each program, but overall the goal is to have really well-trained dogs that have great nurturing personalities that would benefit people across the medical center. So I'll let Valerie speak a little more to Canine Companions.
Thank you, Steve. He's trying to walk Zuni. Thank you. The processes are pretty similar as far as the application processes. They really want to make sure that the dog that they're placing is a right fit. That is very similar in both programs. But Zuni is more command-based as opposed to y'all are bond-based, right? So a lot of that training that they do beforehand is to hone in on those skills, teach those skills, hone them in, and then use them for, if they're going to be a service dog, they're going to help that person with their disability and pick things up or open doors or turn on lights, whatever it is. But those skills for us look a little bit different because we're interacting with more people. Her job isn't to help me with, tasks and a disability that I might have, but she is working more with others and bringing a more normalized experience to the hospital. So we kind of use more of those for the social skills, like interacting with other people and animals for that matter. And then there was something else I was going to say and I just lost it.
I'm distracted by the fact that they're both like snuggling.
I know
underneath the table
they're
right now.
loving each other right now. But yeah, a big part of that's just like making sure that they're with the people that they're supposed to be. Oh, I know what it was. So Zuni's personality is more laid back. She's a little bit more serious, I guess. So she's not quite as in your face, hyper, goofball. I mean, she can be, but that's usually like off work and she's, doing her own thing, just being her dog self. But what's really cool about her is that she's really good at being like, okay, you're too close, or I don't like that. She kind of is able to back up, which is really great for our kids who may need help with like boundary setting, like saying no, or, not being in personal space as close, or, some of those skills that they need. So I call her a diva, but I think it's just healthy boundaries.
And overall, our dogs are going to interact with anywhere from 20 to 100 people in a day too. So part of what both of those programs are looking for are dogs that can tolerate that and you can tell enjoy that work as well. If you have a dog that maybe a really smart dog and has great all these commands, but you can tell maybe a little bit more anxious in like the group setting, that dog would probably be a better fit for a service dog. Whereas these dogs that's across the hospital, and that's even just walking down the hallway for us to go to lunch. We run into anywhere from 10 to 50 people, it feels like some days. So the dogs, we want to make sure that they enjoy their work as well. And that's something that we monitor and we keep an eye on too, as we work with them throughout the day. There are particular days where it's just been maybe a really heavy day or a heavy week. And I know Valerie a couple of times is like on a Friday has been like, Zuni is done for the week, and she'll stay home. And that's decisions that we can make for our dogs too, of we may just have a day where Steve he's had a really busy week, seeing a lot of kids, he's taken a lot of stress away from people, and he needs to relax a little bit. Oftentimes people get a little bit confused when they see our dogs maybe napping or sleeping, and people are like, oh, they're laying down on the job. And the reality is our dogs, first of all, dogs in general need more sleep than humans do. These dogs are no different. But what they're doing, like when Steve is falling asleep in a bed with a patient, is he's trying to absorb all of the stress and anxiety that this family has experienced at the hospital. And that takes a toll. And he does that. He also, I tell people all the time, he's just modeling how to relax. He does it really well sometimes. But we, always have to be mindful of making sure we're taking care of our dogs as well as taking care of all the people here at the hospital.
Yeah, thank you so much for sharing. That's interesting when you were mentioning too with matching facility dogs to, your positions. You do want to make sure that their personality fits work with you because you're working with them for so long. So that's really interesting to know. I personally didn't know that beforehand. And wow, 100 people a day. That can be a lot for sure. So it does make sense that you can't just work with any dog necessarily. You have to find ones that are able to do that. So thank you, for sharing that. That's fascinating. So on like a mental health side, do you mind sharing how facility dogs can help young patients mentally?
Sure. I can.
Yep. I'm like, I'll let Valerie.
Yeah. So a big part of what we do is we are on, the behavioral health, the psychiatric floors. And, as Laura said earlier, coming to the hospital in general is very stressful. When you're coming for a mental health issue, whether that's anxiety, depression, suicidal ideation, or self-harm or whatever it is, and you might have to stay here overnight without a lot of visitors, that's really tough. So a lot of what Zuni does is help kind of take away that anxiety, at least help with it. Studies show that just petting a dog releases oxytocin within your body. So that is like your feel good chemicals. So it can help boost mood. It can help take away some of that, help with depression, anxiety. It can help with normalization. I actually just asked one of our patients this morning, what is it about Zuni that you like seeing when you're here? And she said, well, she reminds me of home. And I think that's kind of a big part of what we do is we want to make this seem a little less scary, a little less anxiety inducing, trying to just bring all of that down so that they can really get the treatment and the help that they need. And if petting a dog every day for, you know, my little group time can do that, absolutely. I feel like there was something else. You can jump in.
Well, I want to point out too that one of our other handlers that works with Neely, she's a clinical therapist here at the hospital. So she incorporates Neely into her clinical therapy sessions. So that's one-on-one sessions with patients of various ages, you know, anywhere from 5 years old to 18 years old. And it's amazing the amount of times that you see someone, you can see it in their body, how their whole body relaxes. A lot of times too won't necessarily make eye contact with, you know, the person they're talking to, but it's like they're talking to the dog, and they open up so much more because they are able to relax. And it's just that simple act of laying on the floor with the dog or petting a dog that allows them to be able to feel like they can be vulnerable and actually talk about their trauma, talk about their situation in a way so that people like our clinical therapists and everybody else can help them to reach their goals, because life is hard. And, you know, no matter how old you are, it's hard to see kids as young as 4 or 5 years old here with mental health issues. That's something that I don't think a lot of people process or think that's even possible, but it is, and we're seeing it. And something as simple, I love that quote about Zuni made it feel like they were at home. That's good. We want our kids to feel safe here at the hospital.
Absolutely.
Yeah, thank you so much for sharing. I know that a lot of families and children, when they're coming into a children's hospital, did not expect to be doing that day. So that can cause a lot of anxiety and fear. And so it's nice for them to have some facility dogs that can help ease some of that stress. My next question for you is how do donations specifically support programs like Sit, Stay, Play?
So donations and donors are the reason our program was started. Our program is completely donor funded. So no family will ever see a bill for having received a dog visit while here at the hospital. And that's because the program is completely supported by donations. All of our dogs' vet bills, food bills, toy bills, anything the dogs need are paid for completely through our program. And as we all know, dogs are living, breathing creatures. And so they have needs just like humans do. And I know Steve's food bill is probably the highest because he's the largest dog and he gets fed about twice as much as any other dog. But it's important to, you know, keep him well healthy. And we have a great vet in town too that provides, you know, all of our services. But our program would not be able to have been started or continue to grow if it wasn't for the donations that we receive and the support we receive in the community. It's amazing how so many people they may not have had any interactions with their dogs, but they hear about dogs in a children's hospital and they're like, that sounds like a great idea. We should support that. And I'm like, yes, you should. And we would love to show you the ways that we're making an impact as well. So it's a huge piece of our program. And last year, we were able to create a new position that was able to help provide the staff support this year. And so that's a new position that we were able to create because of our donors as well.
Yeah, thank you so much for sharing the importance of donations and the fact that they even funded the start of this program. That's huge. So for everyone watching, please consider donating today. You'll really be making a difference for your local communities and supporting amazing programs just like this. My last question before we go into some of the questions we have gotten in the comments is, do you have any favorite memories? I'd love to hear from both of you. Do you have any favorite memories with Steve and Zuni that you'd like to share with us?
Yeah. I don't have any in particular that stick out among others, but I think the memories that do stick out are the ones where I've seen many times where we've had a kid who's really struggling, you know, whether it's crying or just really anxious, or they're afraid to come into the program, and they're, whatever it is, and they're just having a really, really hard time. A lot of times they'll ask us to step in and just like sit down with the kid and just pet the dog and just kind of calm them back down. Sometimes I let them like walk Zuni into the classroom or wherever we need to go together, and just that act alone really just will, bring them back to like, oh, hey, we're here and we're going to do this, and it's going to be good. It might be scary, but you know what, you've got support, you've got the dog here to help you. So those are always my favorite, going from the very upset and you can see it like they're crying, to just smiling and laughing and having a good time. Just that night and day turnaround in just minutes is just one of my favorite things about interacting with the kids in Zuni. Another would be just, some people, most people, when they see us coming down the hallway, and I'm sure this is true for all of the dog handlers, but it's always Zuni or Steve, which, a lot of people joke about, like, oh, I'm sorry I didn't say hi to you. But honestly, for me, if you're excited to see my dog and you're excited and you've remembered her and you just love her unconditionally, just as she loves you unconditionally, that indirect, I guess, contact is just something special. That gives me a lot of energy and a lot of life, and makes all of the hard parts of being a handler that much better. So.
Absolutely. We had a patient that was here for an extended period of time, and it actually was at the beginning of COVID too. So already, the world was being turned upside down, and visitors were restricted here at the hospital, and everyone was just trying to like cope with this unknown thing, which is still an unknown thing, unfortunately. But we had I think at the time she was a young teenager who was on a life-saving machine, where she really was completely in her bed the entire time she was here for about 6 months, and only had certain, very limited visitors. But we started visiting her once or twice a week, and Steve could never get into her bed with her just because of the machines that she was connected to. And at first I was like, okay, how much of an impact are we going to have? Like, he can't even really get up close to her. There was only a limited amount of time where he could kind of get in the chair next to her where she could even see him or reach him or anything. But I remember a couple months in, the parents, they always got very excited when we came in, which always just continued to like fuel my like, okay, we're making an impact, even if I don't feel like in my head is what I pictured. But I remember there was one magical day where we were allowed to get Steve up in the bed with her. And it was this like magical moment. All these different staff members came to like see and witness it. Steve was like dog tired that day, so he just slept at her feet. But I loved this quote, because a lot of times we hear from our like little kids that are teenagers, I think sometimes they're a little bit forgotten in the children's hospital. But she told me, she's like, Steve makes me feel safe. And she was in this what could be perceived as like an unsafe situation, just because of how many things were going on with her and whether or not she was going to even, go home at any point. And just to hear her use that word specifically of like, he makes me feel safe, like firmed it up for me of like, okay, this is why we do what we do, is if we could make one kid feel safe here that, is in a very precarious situation, then I've done my job for the day, and Steve has done his job for the day. So,
I need a tissue.
I know, I'm like, I'm trying not to go. So we're gonna wrap it up there. Just kidding. You're still muted.
Thank you for letting me know the joys of Zoom. But thank you so much for sharing. That personal impact is just so great to hear about. And it really is amazing how much of a difference these facility dogs can make on patients. So thank you so much for sharing those stories. If it's okay with both of you, I'd love to go through some of the questions we've been getting in the chat. So my first one is from Carol, and she's wanting to know, do you visit patients in the emergency department or only admitted patients?
Great question. So currently with the COVID restrictions, we aren't able to go in the ER because of, so first of all, our dogs are not allowed to go into any patient room that's in any type of isolation. And with a lot of our ER patients having to get tested for COVID first before we know if they are not in isolation. So unfortunately, COVID has put a block on us being able to go to the ER. However, we don't only see admitted patients, so we do outpatient visits as well. So we have a huge outpatient clinical building that we are able to do visits over there. And a lot of the calls that Steve and I get for over there are to help with lab work or to help with maybe injection procedures of some sort. So we are able to visit patients on that side as well. We do have 6 dogs, but our hospital is quite ginormous. And so we, can't make it to every call that we get, but we try to as much as possible. And we really rely, I really rely on our child life staff to make some really good assessments as to whether or not they feel like Steve would make an impact. And if they tell me yes, we think it would make a big difference, then we're going to do whatever we can to get over and help them.
Awesome. Thank you so much for sharing. I didn't know about the outpatient visits. So that's great to know about. And then we have another question. So Jeff is wanting to know, do the facility dogs require any sort of special grooming or diet or any other care pertaining to their work in the hospital?
For sure. Much to their dismay, they have to get a bath once a week. And honestly, probably much to our, we have to bathe them every other week. And then we have a mobile groomer that comes the opposite weeks. So we are trying to keep them extra clean. We do ask too that as much as possible for people to hand sanitize before and after petting the dogs. It's not always completely, we can't always stop it when people run up to us in the hallway, but we do bathe them once a week, and then they all are on a pretty kind of specific diet. We do weight check-ins. We want to make sure our dogs are, healthy and stable because they're on their feet so much more than a regular, dog at home. And so we are very aware of just being mindful of their joints and their muscles, that because hopefully they're going to have a long career. But if we add on extra unnecessary weight to them, then that's going to put more pressure on their bones, and we don't want to do anything that would be harmful for them in that way.
I know for Zuni, coming from Canine Companions, she's supposed to be brushed every day, and then nails clipped once a week, and teeth brushed every day. So a little bit extra. It's really fun to brush a dog's teeth.
Yeah, Steve had to do that. He just chews the toothbrush.
Oh, well, she licks the toothpaste, so it's a whole process.
Yeah, thank you for sharing. That's really interesting to know. So thank you also, Jeff, for that great question. We do have another question as well. So the last one, I'll go ahead and just wrap up with this one. So Vivian is wanting to know, do the dogs stay with you after work hours, or do they live in the hospital or facility that they're working in?
Great question. I forgot to address that earlier. We do get that a lot. People ask if there's a kennel downstairs for all the dogs to hang out with. But no, all of our dogs go home with their handlers. So every dog has 1 to 3 handlers that work here at the hospital. So they are able to go home with any one of those handlers. There's usually a primary handler for each dog. And so, but we all have a lot of us have more than one handler except for Valerie, but that just allows our dogs to work in many different areas across the hospital. But yeah, when they're outside of work, they're out of vest, they're normal dogs. That's what Valerie spoke to that earlier, of Zuni kind of having a little bit different personality outside of work than inside of work. I feel like that's pretty similar for a lot of our dogs. They know when they're in vest that it's work time. And when they get out, they're like normal dogs.
Yeah. It's funny because it's probably been maybe 2 months now. So Zuni and I have only been here for about a year, but only 2 months ago, we took our PHP kids outside to play during some of their free time. And when we're available, we like to go out and play with them, let the kids see her outside of the work environment. So, all of her equipment came off. She's running around in this fenced in area, and the kids love it. But one of the staff members was like, I have never seen her be silly and goofy. It's a totally different dog. And I mean, that's just kind of how these dogs are. They're, kind of serious about their job. And when they're not working, they're just a regular old dog, just having a good time.
That is great. Thank you so much for sharing. And for everyone listening in, just a reminder, your donations are funding programs like Sit, Stay, Play that are making a huge difference in the lives of these pediatric patients and their entire families. So thank you again for both of you for your time today. And yeah, thank you all for tuning in. Have a great rest of your day.
Thank
All right,
you.
thank you.